Hi everybody, I am Dr.Sunil.K.Mathai from Medical Trust Hospital, Kochi. I have been in practice in gastroenterology for the past 25 years. And I thought that we should have something as a message to the layman as well as the practicing gastroenterologist by quoting my past experience in medicine, gastroenterology and life. One of the things which I always felt regarding my patients as well as the doctors who are practicing is the stress which they are facing. This stress occurs from childhood. This occurs in adolescence, as a parent, as an adult, as a grandparent. The childhood stress starts with the moment the parent says that this is what you have to become. Either you become an engineer, either you become a doctor, a lawyer. But once they have set the target, then starts the stress. An IIT education course starts in childhood. By the time they are in kindergarten, they have already been put. The idea has already been passed into their head that you have to become an IIT graduate. And then starts the stress, the education. And the child, as they grow into adolescence, they are already faced with a very stiff target. Expectations accumulate inside the family on them. And then what happens? Finally, they burn out. The stress which they are facing is something which is cumulative, and over the years, you understand that this burning out phenomena occurs in every field. As a doctor, I have seen many of the people wilt when crisis occurs. The 24-hour duties, the security difficulties with a job, the constant change in the way the patient sees you, the amount of litigation which the doctors face, the family difficulties which the doctor face, everything is something which is cumulative. So what does it lead to a person? How does that affect you? This is somewhere where I thought that we should have a discussion on this brain-gut axis. 80% of the people who come to your OP, they come with irritable bowel syndrome or functional dyspepsia, as we call it. Now, if you analyze the root cause of a functional dyspepsia or an irritable bowel syndrome, mostly we find, of course, there are genetic things which run in families and all this, but then if you analyze them, what we find is this sort of stress, which has been cumulative, is the root cause of it. Most of them suffer from either a bit of anxiety, either a bit of depression, either a target-oriented approach to life, where sometimes you tend to burn out, and this burning out, sometimes the patient says that it occurs as multiple symptoms throughout the body. Either it's a constant headache or it's a chest pain. And around 50% of the people, the symptoms are concentrated on the abdomen. They say, I have got a burning sensation. They say, I wake up in the morning with a bloating sensation. I feel nausea in the morning. I don't want to go to school. In the summer vacation, they are loaded again with a lot of job to do, and these people have got no relief from the constant stress they are facing. And this phenomena, what I would like to discuss about then is what is called the brain-gut axis. Now, gut is a thinking organ. Outside the brain, we know scientific data, we have scientific data to say that most of the neurons lie in the gut, outside the brain, which means that the gut is a thinking organ. So emotions which come up inside your brain whether it is anger, whether it is anxiety, whether it is depression, whether it is any sort of emotional character which is depicted in the brain, definitely it's transmitted to your GI tract. So what happens? The intestines, they react in their own way. They are not, they can probably perform only functions like, they can perform a function like motility, move, propulsive movements which in fact get disturbed. Digestion, secretion, these get disturbed. Because the emotional reactions release hormones, release signals to the GI tract, and whatever emotional disturbance occur, as you call in the upper story, is transmitted down into the lower story. So we get lots of sensations in your tummy. We get a burning, a bloating, constipation, diarrhea, a lot of things which disturb our day-to-day routine. And then, as a layman, when they come to the doctor, they say, my child has got gas. I've got bloating. I've got the sensation of going to the toilet every time I face a crisis. So this phenomena is called the brain-gut axis. Now, when you consider the functions of the gut is this movement, propulsive movement, which gets disturbed, which means if the propulsive movement slows down, you get bloating. If it is going in a rapid way, you get increased gastrocolic reflex, you get increased bowel movements, frequency goes up. So, on either side, either it is constipation, bloating, or it is diarrhea, you find the root cause is that emotional disturbances or the stress which accumulates on. How to get out of it? Now, what a normal person does, it includes doctors. I mean, what a normal person does is, of course, get relief with drugs, take medications long term, or they resort to probably what we call stress relievers like alcohol, drugs. But this is something which, as the time goes on, you find that these drugs, these alcohol, these methods which they resort generally to relieve the stress, they harm the body. They have their own cumulative toxicity which slowly burns out the physical part of the body. So you find fatty liver, you find accumulation of more fat in your body, you get breathlessness on walking because your weight increases, you tend to have sleepless nights, snoring, obstructive sleep apnea. A lot of things keep on accumulating. Now, how can we get out of this? Is it the drugs which are the ultimate thing which can protect us? Is there any other way out? Yes, there is a way out. I've always thought that these addictions which you build up in childhood itself, the TV, the potato, the couch syndromes, as I call them, sitting in front of the computer, 24-hour seeing the TV monitor, 24-hour playing the video games. Now, what does that put you in? Slowly your brain damage or neuronal damage occurs. Slowly your physique deteriorates. The way out, I always thought, was what we call exercise. Now let us consider this exercise in different ways. Exercise is something which can be done as a solo phenomenon. People buy a treadmill and start working at home. 3 days, 4 days, 1 month, and then you find the treadmill lying in one of the waste baskets. In the garage, you will keep the treadmill and say that I proudly demonstrate to others this is a treadmill which I brought. See, the problem here is a solo exercise phenomena has got what is called a monotony. When it is monotonous, you tend to break the schedule because you don't enjoy it. You are alone doing it. It becomes a ritual, and that there is no motivation to it. If anybody can cope up with it, it is fine. Please continue. But then, if you resort to a group game, different ages have got different group games. For example, you can play tennis till the age of around 70 years. You can play badminton till around the age of around 60 years. You can play football till around the age of around 45 years. You can play basketball, you can play volleyball. There are a lot of things or group games you can indulge in. Group cycling, group walking. Form a group. A group does a lot of things. It is a major stress reliever. When you are in a group, you feel like talking to each other, downloading to each other your problems. You tend to share and tend to care. This is a major venting out phenomena. Now, what we should understand is two things happen here. Your physical toning happens in a way you enjoy. Apart from that, your mental outlook changes. And this, in fact, reflects on, as a gastroenterologist, the brain-gut axis. I have seen, I'm a person who plays almost badminton every day. I have seen people sharing with us their problems, and then with a heavy attitude, when they share it, the problem becomes so light. And when they go back, they understand that this is not a major problem. And then they tend to ignore it. So dyspepsia sometimes disappear. Small gastrocolic reflexes, it is a sort of biofeedback which we are getting from these group games. I have always been an advocate to this. And these are the ways where you can probably tone up your health in a much better way than addict to alcohol or drugs or TV or computer. Now, apart from sports, people have always been telling me or sharing with me that my physique is not fit for sports. I disagree. In fact, my joint is paining, my shoulder is not well, so I can't do anything. That is not a right attitude. Now, when you start a group, you will understand these ailments are something which many people have in common. So then, again, you tend to share it and start doing the routine in a manner which you enjoy. Your pains will disappear. So most of the sports which you choose can also be chosen considering your physique. For example, swimming. You form a group swimming habit. 3 or 4 people club together and go for swimming. You will enjoy it. You play a bit of polo in the water. Generally, aches and pains don't matter much there, because in the water you find most of the joints work very well. Now, hard sports is better to be avoided. Especially as the age grows, a lot of crisp bending, a lot of sharp movements might injure you. And injury is something which you should always bear in mind when you choose your sports. Something else other than sports is always the dietary things which, as a gastroenterologist, I have to stamp on. See, the diet which we normally consume is a balanced diet. Where do we go wrong? Our domestic diets are generally balanced. We have a breakfast, we have a lunch, we have a dinner. See, only when we tend to gorge, and gorging occurs sometimes as a release phenomena for some people. Sometimes as a social function, you tend to take alcohol, you eat a lot and you overfill your tummy. And people say that I'm fully gorged, that I've eaten up to my neck. Now these are things which probably we have to
avoid, a lot of voluntary effort has to occur there. So when you eat, you can eat everything. You can eat non-vegetarian or vegetarian, but then balance your diet. See, why do the Indian population, generally they are in stature, they are small? Because our protein diet in childhood is very little. We eat a lot of carbohydrates. Protein is something which builds your muscle mass. So a balanced diet is something which you have to practice from childhood. There should be a lot of fiber in it. There should be proteins in it. There should be enough carbohydrates in it. You can probably reduce on the fat content, because fat is probably the one that, in fact, most of the specialists, whether you are a cardiologist, a neurologist, or a gastroenterologist, we tend to lay down the fat content. We always say that please reduce your fat content in your diet. Fat is something which is cumulative. It probably accumulates in your blood vessel, it accumulates in your liver, it accumulates in your tummy. So reduce the fat content, and enough fat according to the balanced diet is something which we would suggest. Diet, exercise, sports, these are 3 things which I strongly advocate to correct your brain-gut axis. It, in fact, will tone up your body, it will tone up your gut, it will improve your bowel movements, and you feel an overall health with it. So this is probably my, as anybody would call, a silver jubilee of 25 years in gastroenterology. This is probably the message which I would like to impart. To correct your brain-gut axis, resort to sports. Sports for recreation, sports for health. Thank you very much.